Hello, my name is Bassel Saig. I'm a cardiac electrophysiologist at the Excella Health Heart, Lung, and Vascular Institute, with offices in Greensburg, North Huntington, Latrobe, and Mount Pleasant. I went to medical school at the University of Damascus in Syria. I then did internal medicine residency at Loyola University in Chicago, Illinois, followed by a cardiology fellowship at Allegheny General Hospital in Pittsburgh, and a cardiac electrophysiology fellowship at the University of Pittsburgh Medical Center. I specialize in all types of arrhythmia, specifically the treatment of atrial fibrillation and the prevention of stroke. The heart is divided into 4 chambers: the atria, which are the 2 small upper chambers, and the ventricles, which are the 2 larger lower chambers. Together, they pump blood to and from other parts of your body. Atrial fibrillation, or AFib, is a heart condition that causes the upper chambers of your heart to beat too fast and in a chaotic rhythm. Atrial fibrillation is a common cardiac arrhythmia and is a growing problem. There are approximately 5 million people with AFib in the US. By 2030, up to 12 million Americans may be affected. AFib can have a significant impact on your quality of life, but treatment options are available. First, there are different types of AFib. Paroxysmal, which comes and goes and usually stops on its own. Persistent, which lasts more than 1 week. Permanent AFib is when the heart cannot be restored to normal rhythm. As you grow older, the risk of AFib increases, especially after the age of 60. What can cause AFib? This can be related to age, hypertension, structural heart disease, extensive sports, genetic factors, alcohol, and many other factors not yet identified. The signs of symptoms of AFib are shortness of breath, lightheadedness, fatigue, racing or fluttering heart rate, palpitations, or sometimes no symptoms at all. People with AFib may be at greater risk for stroke than people with normal heart rhythm. AFib raises the risk of heart failure, blood clots, and stroke. But how does AFib increase the risk of stroke? There is an extra piece of tissue in the upper chamber of the heart called the left atrial appendage. The left atrial appendage is where clots form. AFib causes the blood to pool in the left atrial appendage. The stagnant blood flow creates an environment for the blood clot to form. The blood clot then dislodges from the left atrial appendage and travels through the arterial system. The clot then lodges itself into the blood vessels of the brain, restricting blood flow and causing a stroke. Did you know that approximately 1 in 3 people with atrial fibrillation will have a stroke in his or her lifetime? More than 90% of stroke-causing clots that come from the heart originate in the left atrial appendage. AFib-related strokes are more frequently fatal and disabling. Luckily, there are treatment options. The goal of treatment with AFib is most importantly to improve quality of life and prevent strokes. How is AFib managed? This is done by rate control, which is treatment to make sure the heart doesn't beat too fast during AFib, and rhythm control, which is the treatment to restore the heart's rhythm to a normal state and keep it there. Maintaining normal rhythm is done with lifestyle changes, including regular exercise, eating a heart-healthy diet, refraining from smoking, and watching alcohol and caffeine intake. There are also medications and the AFib ablation procedure. The second goal with the treatment is to reduce the risk of AFib-related stroke and related complications from blood clots. Treatment options are available to protect you from stroke or related complications from blood clots. These include oral anticoagulation medicine known as blood thinners or left atrial appendage closure. Oral anticoagulation medications are medications that can reduce the risk of blood clots that could lead to stroke and work mainly by thinning the blood. Common blood thinners include warfarin, known as Coumadin, Eliquis, Pradaxa, or Xarelto. Most people can take blood thinners for years without serious side effects. But because blood thinners help prevent clots by thinning the blood, they also increase the risk of bleeding. Talk to your doctor. When considering your treatment options, your cardiologist will weigh your risk of stroke against your risk of serious bleeding problem. An alternative to blood thinner would be the left atrial appendage closure. Left atrial appendage closure means closing the left atrial appendage as an effective way to reduce stroke risk in people with atrial fibrillation not caused by heart valve problems. WATCHMAN is a permanent implant designed to close off the left atrial appendage so blood clots can't form there and escape to cause a stroke. WATCHMAN is a left atrial appendage device and is a one-time, minimally invasive procedure that may reduce stroke risk for a lifetime. It is an effective stroke risk alternative to blood thinners. WATCHMAN reduces stroke risk without the worries that come with a lifetime of blood thinners. WATCHMAN is about the size of a quarter and made from very light and compact material commonly used in many other medical implants. In a clinical trial, 96% of people were able to stop taking blood thinners just 45 days after getting WATCHMAN. The WATCHMAN implant does not require open heart surgery, nor does it require surgical cuts or sutures. It cannot be seen outside the body. The procedure is typically done under general anesthesia and typically takes less than an hour. People commonly stay in the hospital overnight and leave the next day. To implant WATCHMAN, your doctor inserts a catheter in your upper leg. Your doctor then guides WATCHMAN through the catheter into your left atrial appendage. After the procedure, you'll take blood thinners until your left atrial appendage is permanently closed off, usually just about 45 days after the procedure. During that time, heart tissue grows over the WATCHMAN implant to form a barrier against blood clots. As with any medical procedures, there are risks involved with WATCHMAN. Talk to your doctor so you thoroughly understand all the benefits and risks of the WATCHMAN implant. WATCHMAN has been studied for more than 20 years. The WATCHMAN implant is the only FDA-approved implant proven to safely and effectively lower stroke risk in patients with atrial fibrillation. Worldwide, more than 150,000 people have received the WATCHMAN implant. WATCHMAN may be right for you if you have atrial fibrillation not caused by heart valve problem, known as non-valvular AF, and you've experienced major bleeding while taking blood thinners, or you have a lifestyle, job, or health condition that puts you at risk for major bleeding. People who should not receive the WATCHMAN implant include but are not limited to those who cannot take oral anticoagulants, aspirin, or Plavix, known as clopidogrel, should not or cannot undergo heart catheterization procedures, have an allergy or sensitivity to nickel or titanium, have a left atrial appendage that does not fit the WATCHMAN implant, or people who are taking blood thinners for a condition other than atrial fibrillation. WATCHMAN is covered for eligible Medicare patients who meet certain national coverage criteria. It is also covered by an increasing number of commercial insurers. Thank you for listening to this presentation. For more information, reach out to our structural heart nurse navigator at 724-691-5543 to schedule an appointment to discuss further.